thanks so much for joining. Speaking of making healthcare work for you, different perspectives and empowering solutions. I'm Stephanie Fields, joined by my co-host, Dr. Apoorv Gupta. And today we're talking about our interview with Kyle Kiser, who is the CEO of RxRevu. And it was really cool talking to Kyle. I like that we've had a number of people working on lowering prescription costs lately, which is something that's so important because it really impacts everybody. I mean, who hasn't had a prescription or won't need one at some point? And so many people need maintenance medications on an ongoing basis. And so RxRevu works to connect the dots and provide data to give providers real-time data about the lowest cost options, taking in, instead of maybe prescribing this pill, is there a different formulary that they could do, or a different pharmacy that they could use, or a different quantity? I thought that was an interesting point, that sometimes he said prescribing 8 days instead of 12 or 12 instead of 8 can really make a difference on the pricing. And I also thought it was cool that they're driven by a personal mission. The founding physician of RxRevu, when they were founded in 2013, was inspired to do this because of an experience with his own mother. Whenever she went to her son and said, I'm paying $900 a month in these medications, and just by changing a few things, they would drastically reduce the amount that she's paying. And so I thought that was a cool theme, that they said, now we say Lucy up, which means, you know, when you get too caught up in other things, to forget about all those ancillary things and really just focus on the mission of who are those Lucys and the Lucys in your life that we're helping. Apoorv, what did you like about this interview?
I really appreciated learning about this industry. It's actually something that could become, relatively unknown to the provider and to the patient, because it's sitting behind the screen, and so you don't really know what's happening. So it was fascinating to me what Kyle was talking about, that this is now being mandated by CMS in terms of a benefit that needs to be offered for Medicare Part D. That's a good thing. That means that the industry is fairly mature, and there must be other players like RxRevu out there that are trying to bring more transparency on the cost side, at least, to the equation. I really liked what he had to say about making sure that it's built into the workflow. I think he spent a lot of time talking to us, and hopefully it comes through to our audience, about how the process is designed so that it's really before the provider is even done with the complete transaction, during the time that they're entering in the order, that they're already, their system in the background, based on the rules, is going off and checking the formularies and making sure that the medication being ordered is the right one for that formulary, in the right amount, in the right dosage form. There's so many different variations that could happen, and then providing that feedback right back to the provider in the event that they need to make a change. And apparently that's the way they're measuring their success. So RxRevu is thinking the likelihood of us being able to give helpful, relevant information back to the provider and create what they call behavior change, making some change in either the pharmacy, the formulation, or the dosage, is what they consider a sign of success. Appears to be working. Their customers seem to be asking for this tool. I would love to have also heard a little bit more about the patient experience and how they know that it's working on the patient side. So hopefully that's data that at some point Kyle and RxRevu will be able to share with us at some point. But to me, it seems like a very fascinating tool that's built in a way that should actually be able to help all the parties they're trying to help: the pharmacy companies, the PBMs, the payers, the providers, and the patients.
Absolutely. It's a great interview. So be sure to stay tuned for the full interview on Thursday, and we'll talk to you soon. Bye-bye.
Bye-bye.